Okay, so the third aspect is looking at decreasing pain. We want to settle the pain and decrease the pain as soon as possible, ASAP. Some of the key things that you can use in terms of decreasing pains, for some people, probably about 20 to 30% of people, using an ice pack, wrapping an ice pack up in a towel, putting it on for 10 minutes, taking it off for 20 minutes and putting it back on for 10. That will help to decrease some of the symptoms that are actually presenting and look at decreasing pain. Some other things that you can use are over-the-counter preparations from your pharmacy or chemist shop that help to anti-inflammatory properties. Now you need to be really careful and need to check with your GP or doctor that you won't get any adverse reactions to these particular products. Particularly those people who are taking medication, you need to check that with your doctor before you actually do that. And so these over-the-counter preparations, you can rub onto the area where you're getting pain. And what they normally do is they normally decrease the swelling and decrease a little bit of the inflammation. And when they actually settle and decrease the inflammation, that's when you actually get the pain relief. Look at using those in combination with using the ice pack. One of the key things to really remember, if anything aggravates things or makes things worse, then stop it. Stop it immediately. We're about getting the symptoms to settle down and not actually making things worse. Some of the other pain relief, sometimes it's rest, particularly with foot injuries and particularly acute injuries. So let's say you've twisted your ankle. Sometimes it's just about having rest to allow the actual part to settle itself down and heal. And one of the key things is actually lying down and slightly elevating the foot, so it's about say about 3 to 4 centimeters above the level of a heart, so the fluid can actually start to drain back into the heart. Sometimes just doing very gentle movements of the feet, so pumping the calf muscle up and down. And what that will do is that'll get the fluid moving out of the area as well. With any of these activities, if it aggravates or makes things worse, then stop them. Really simple, really key. And so look at elevating. If you can do that anywhere from 2 to 3 times a day, that would be fantastic and great. The other thing about doing decreasing pain is decrease those activities that aggravate that aggravate the foot or aggravate your foot pain. So let's say you're a runner or an athlete and you get to about 5 to 6 Ks and the pain starts to kick in. Well, what you may find is rather than running is that you may have to do some cycle activity or some swimming to keep up your levels of fitness and until the actual injury starts to heal and settle down and repair itself. Some of the other things that you can actually do to decrease pain, if it's really acute pain, you don't want to be massaging the area, but let's say you've had the pain for a couple of months and it's not settling itself down, sometimes gentle massage in the area can actually start to settle it down. You need to be really careful. A couple of things is, one, if the massage aggravates or makes things worse, stop it. If it really causes intense pain and really flares things up, well then you should seek medical advice. This information that I'm giving you is just something to supplement you before you actually go and get professional advice. And I'd highly recommend that you need to go and get professional advice regarding what's going on with your feet.